talking about your vascular Ehlers-Danlos syndrome. What is it? What are the symptoms that affected you? When were you diagnosed?
Yeah, so that is a very interesting story, actually. So we call it VEDS, VEDS, which stands for Vascular Ehlers-Danlos Syndrome, but that's a mouthful, right? So we just say VEDS. It's a connective tissue condition that results from a genetic mutation in how your body produces collagen 3. And because you don't have good collagen 3 in your body or enough of it, you're prone to spontaneous artery dissections, spontaneous artery ruptures, like full ruptures, including your aorta, which is like the biggest blood vessel in your body. You're also prone to bowel perforations, so like intestinal perforations, and uterine rupture during pregnancy, lung collapse. There's a lot of complications and life-threatening emergencies that come along with the diagnosis of VEDS. I wasn't diagnosed until I was 28 years old, and I had experienced like some minor, I wouldn't call them symptoms, they're more like signs because it's a genetic condition, it's with you your whole life. But my whole life I had like thin translucent skin, so you can see the veins all over my body. I've got what's called acrogyria, which is like an aged appearance to the hands. They look kind of like if you only saw them, it'd be like I'm 80, but I'm not. And let's see, bruising all over the place. I tore my ACL by just a simple fall. I tore my ACL all the way through. And I've got some facial features of the disorder as well. A thin nose, large almond-shaped eyes, and some people have very thin lips as well. So there are a lot of like outward appearance kind of signs that might point to a diagnosis of VEDS, but the major criteria are an arterial dissection or rupture, a bowel perforation, what's called a carotid cavernous sinus fistula, which is a bleed or it's like an improper communication between the vein and the artery behind the eye, and uterine rupture without a prior C-section. So I didn't have any of those. I had a lot of the minor symptoms, which also point to a diagnosis, but nobody was really familiar with that that I had met, so every time I had asked about some of these things throughout my life, it was like, oh, well, that's normal. Oh, don't worry about that. It's not a big deal. And when I was 26, I had this spontaneous severe neck pain. I thought my head was going to fall off. And that started this like 1.5-year journey of battling with this sudden onset, spontaneous neck pain that had no explanation. Physical therapy didn't help, yoga didn't help, chiropractic care didn't help, pain management clinic didn't do a whole lot for it. All my MRIs and x-rays were normal. And it really started me on this very frustrating long journey of what the heck is going on with me. And it was very hard to get through every single day. In 2017, I kind of stumbled on VEDS online when I realized somebody had missed something. And I was sitting down on my living room floor and I was writing down everything that had been weird about me in my life. And I ended up Googling it and found it. 3 months later, I finally got a genetic test and got the diagnosis of VEDS. So I was 28 finally. And it turned out that neck pain was actually a dissected artery. And I had never had a scan for that.
Wow.
So it's kind of a long story in a nutshell, but it was very interesting for sure.
I'm sure. So how do you manage your bruising, your, making sure that certain, parts of your body don't get, hurt?
Yeah. So there's no preventative treatment proven to 100% to prevent these vascular complications, like the very severe ones, the life-threatening ones. I am on a high dose of vitamin C to help with the bruising. But I mean, it's really it. It's really, you have to be prepared for emergencies and have a good care team set up. And, they kind of, I guess, prescribe some lifestyle changes, like following a lower risk exercise plan where you're not participating in very heavy weightlifting, you're not exercising to the point of fatigue, you're not participating in collision sports, which might, bring something on. But by and large, we don't have a proven 100% tried and true way to prevent these things from happening. So unfortunately with VEDS, that diagnosis comes along with a very, not a good survival rate. It's not great. By age, I think the latest research, by age 40, 80% of individuals have had a major medical complication. And I think it's about 50% in that particular study survived to the age of 51. So it's pretty severe.
Wow.
Yeah.
That's telling me this, somebody who doesn't have it, it's very, well, it's interesting, but, some of the characteristics, are just so severe. And I look at you and you seem, obviously a great woman, and you're, we'll get into obviously what you do and so forth. And you're married, you have such like a fulfilling life, and then you hear about this, and it's, you're courageous, and I'm sure you're more courageous than other people that have this, have this disease.
Oh, thank you. By and large, everybody I've met with this has just been, this community of individuals with VEDS, they're so courageous and brave, and so many of them face every day knowing that this is a thing hanging over them, and it's like this community is the bubbliest, funniest, like they'll step forward for each other any day, and it's really inspiring.
No, it's great, and we'll get into more.
Yeah.
So what resources are there for VEDS?
Well, now we have more more resources than we've ever had before, I would say. Starting in 2017, a researcher at the University of Washington, who's a vascular surgeon, Dr. Shireen Shalhoub, started the VEDS Collaborative, which was a group of researchers and patients and other stakeholders that were really trying to drive research forward, because there's not a whole lot out there. So, she really got this wonderful network kind of started of everybody just wanting to do more and drive research in the area that patients wanted it to go. So they started heavily engaging the community in surveys and calls and webinars and all this stuff. I was very heavily involved in that group as an advisory board member. And that is still ongoing. Dr. Shalhoub launched a natural history study at the University of Washington, which is the largest VEDS natural history study in the United States. Very, very cool study. If anybody is listening to this and you're diagnosed with VEDS and you haven't looked at that study, go to vedscollaborative.org to enroll. That's very important. But that really, it kind of started this snowball of so much support. And the Ehlers-Danlos Society started doing more, and the Marfan Foundation came on board with the VEDS Collaborative, and a few months later invited the VEDS community to their annual conference, had a whole track set up for the weekend with educational presentations and workshops and social support, and really brought the community together. And then in October last year, I came on board with the Marfan Foundation, and we launched the VEDS movement, which has monthly support groups for all sorts of people in the community. We have, well, right now everything's kind of on pause. All the physical stuff is on pause because of COVID-19, of course, and we want everybody to be safe. But, up until this point, regional symposiums around the country so that you can meet your local experts and other people in your community. Annual conference, of course, is a big event. Local fundraising and fun events to attend where you can meet other people in the community. And through the VEDS movement, I mean, we have our whole dedicated website now to VEDS so that you don't have to pick through information on this website and this website and this one over here, and maybe you find a piece of information in this paper that you found. It's all on our website. We've got a wonderful network of physicians. I mean, we are really trying to move it forward and provide excellent support to the community. So there's a lot now out there as a result of all of that in the last 3 years.
Yeah, no. And you are the director of the VEDS movement.
Yes.
So how did you decide that you wanted to work in the VEDS movement and in the, medical health community?
It was really, I don't think it was an active decision until it was already happening. When I was diagnosed in 2017, I didn't know anybody else with VEDS. I felt very alone, and I felt a little fired up about how long it had taken me to be diagnosed with this life-threatening condition, especially with the impact it had on the 1.5 years of neck pain that I had experienced with no answer and then shuffled around. And, I was like, that shouldn't happen to anybody. And I didn't want it to happen to anybody else. And the most logical thing I could think of to do was just start a YouTube channel to start raising awareness. And I had no idea really what I was getting into. I was just like, I'll just start a blog, So I get on the computer and I start blogging. And before I know it, people start reaching out to me more and more in the community. And it would be a comment like, oh, my brother was just diagnosed with this, or my niece was just diagnosed with this, or I was just diagnosed with this. I'm so glad I found this. And it really, really catapulted me into this space because it was so special. And all of their stories were so unique and important. And I was like, there's other people out there who feel the same way I do. And that really brought me into that space. So once I started, Shireen invited me to the VEDS collaborative work, and I loved that. It kind of became this second full-time job in my free time that I absolutely loved. I love the research space. It's a lot of fun for me, and it's so interesting. And then I started a podcast where I started talking to people about their stories, because after so many people had reached out to me, I was like, it shouldn't be just about sharing my story with VEDS. Everybody's story is so important. And if, we can get that out there, people won't feel as alone. And it can provide this understanding to people outside of that space. So by the time 2019 rolled around, I'm in the VEDS collaborative. I'm doing a podcast, I've got a vlog, I've got a blog, I'm speaking at conferences here and there, and all of a sudden I'm just in this space. And it became evident kind of in 2019 that I was not going to be able to keep doing both of these things forever, because there would be weeks where I was working 40 hours Monday through Thursday, and then Friday morning, I'd hop on a plane and I'd go to a conference, and I would pretty much work 40 hours over 2 or 3 days, and then I'd fly back and go right back to work. And it was crazy. So it was kind of a natural progression into this, I want to do this full time. And it was such a passion that there was no way that I could choose the other. So when the Marfan Foundation said that they wanted to really give VEDS its own identity, I was, jumping on it. I'm like, let's do it. Let's go. I'm ready. And that's how it happened. So all of a sudden I just kind of found myself in it, and I was like, well, I'm not going to stop now.
You can't stop, and you're an inspiration. So it all works together.
Thank you.
So getting back into your VEDS and the regular struggles that you have to deal with, manage, and so forth. Can you talk a little bit about what parts of your life have been affected, if any, whether it be, your career, what you perhaps were thinking prior to, getting
Yeah.
your diagnosis of VEDS, uh, you know, friendships. I mean, if anything, in terms of, your, obviously being married, um, family.
I would say that VEDS impacted every part of my life when I was diagnosed, because it just like it yanks you out of your plan. And as any, like, you know, at the time, I mean, it just felt like this sudden death diagnosis. And I didn't understand whether it was a sudden death diagnosis or whether, there's so hard to find information online. I just felt like maybe I would live to like 48 or 49. I kind of took that as a life expectancy, not a survival rate. And so I was like, okay, well, I have, in my head, I was like, okay, I have maybe 15, 10 years left, who knows, and learning, like coming to terms with that and learning more about it and kind of stepping back from that, like, okay, that's not the right understanding, like just learning all of these things and coming to terms with it. It does completely change your life. Things that I loved before became very stressful in some ways. Whereas exercise before was something that I really loved and enjoyed, and I was like all about. I was very athletic prior to this point. The more and more I learned, the more it came to my mind when I was doing these things that, oh, I could have a dissection or a rupture right now, or oh, I could be everything that I was doing. It just invaded my mind. But I think overall, I think it affected me in a positive way because I got involved with this wonderful community of people that I never would have met. I had no idea. There was nobody else in my family with this condition, and it can be passed on through families, but I'm the first one. And so I'm just meeting people who are like me, and I'm meeting these amazing researchers and these amazing physicians that just want to help this community. And I don't think I would trade that for anything. Like I know that my life will likely not be as long as it would be if I didn't have VEDS. It's pretty unlikely. But I wouldn't trade it. I mean, it just became such an intense passion, and such lifelong friendships were developed from that it was kind of a good thing. I don't know. I don't know how that can be a good thing, but I just don't think I would trade it.
No, I totally understand. Things happen for a reason. Obviously, some things are more unfortunate than others. For you, obviously, having this disease is not something that you would have thought or you've even wanted. However, you're managing very well. You're doing things that you really, enjoy and are passionate about. And the people that I interview on a regular basis, they all say the same thing. They wouldn't trade it for the world. I think it really shapes you as a person. And especially if you can find that meaning and purpose, I think it's very positive. As unfortunate it is that you have a disease and there are complications.
Yes, I totally agree.
What has been your greatest obstacle to date?
I think, it's really hard to narrow that down. Medically, I mean, I had multiple mini strokes over a course of like a year, which was very, very challenging. We didn't know why they were having them, why I was having them. Combating the loneliness at the beginning of diagnosis was also very hard. But I think the biggest challenge that I continue to, I don't want to say deal with, to experience is the amount of loss that we experience in this community. just this year, I've lost 3 close friends to this, and we lose community members that I haven't even met at an alarming rate. And that, you know, when I first got into this space and started advocating for VEDS and meeting people, it was really, really heavy because before I was like, that was really the only challenge about coming into the community, is that you're surrounded by all these people who get it, but because they have the same risks you do, you're losing people at a really high rate, and it's devastating, absolutely devastating. So at the beginning, that was just a big shock. The first few times that we lost a community member, it was a huge shock, and it really made me think about my own mortality. But the more and more I got involved with the community, the closer friendships I developed. And there were people, I would talk to John DeMasi almost every week on the phone, and so when I got the call that he was gone, it was just devastating, absolutely devastating. And it really, it's so tragic to lose people at such a young age from something that you really don't have a lot of control over. You can be eating healthy and doing the exercises that you're supposed to do and not doing the exercises that you're not supposed to do. And you're not a smoker. You're doing all the things that are recommended to stay healthy, and you still have no control really over what goes on with your body. And it's just a really hard thing to cope with. So I think that the amount of loss in the community has been an obstacle that has really kept me fired up and on the front line of advocating for VEDS, because it's immediately devastating. And then I'm just I'm not going to not do anything about it. Every time it happens, I'm just really, really sad. And then I'm okay, we have to do better. We have to fix this. How can we raise more awareness? What can we do now? Who can we get involved with? And it really, I think that's how I manage it, is I just remember them forever and use that energy to bring more awareness to the condition.
And, they are, even though people have passed on from this, they are technically here, even though they're, their spirit.
They're right here.
Yeah, exactly. And I think that keeps a lot of people moving, even those people that have lost loved ones, just, a grandmother, a parent, because unfortunately life is hard, and you have to manage all of these obstacles that get in your way.
Definitely.
What's been your greatest strength?
I think
and what have you learned about yourself as a result of having VEDS?
Well, I think from a strength perspective, I'm grateful that I was able to persevere through the 1.5 years of pain, the 27 years of up and down. Maybe I have something, maybe I don't. Maybe I have something, maybe I don't. The mini strokes were really challenging. I guess my strength is how I've been able to persevere and just keep going through it and try to maintain a positive attitude. And, I have my days certainly where I am not positive, but overall I try really hard to just keep going. And I think that determination has been one of the major strengths that has led me to where I am today and leading this amazing organization and life. Yeah.
When you have lost hope, or felt you were maybe a failure in life and just really down on yourself, what helped you to persevere and push forward?
I think there are a couple things. A major is my mom, for sure. When I didn't know I had VEDS yet, but I was in all of this pain with no answer, I remember going to an urgent care and a dissection had happened, but we didn't know it, and the urgent care I had been to before, and they said, we've already done a scan. There's nothing we can do to help you. There's nothing wrong in there. And it was just devastating. And I really started to feel like I was the problem, like I was a hypochondriac, that there wasn't anything wrong and that it was all in my head. And, coupled with the fact that I was going to be in pain the rest of my life with no reason. And I remember one night after that happened, I called my mom and I was completely beside myself about this. And she said, Katie, if you feel like something's wrong, don't give up, find the answer and just do it. And that really taught me this lesson of like, I have to be my own advocate. And that's something I think that from that moment really transformed the way I treated my own medical care, the way that I conducted myself in doctor's appointments, and the way that I conducted myself in my life. So I really attribute that to her, because then I was able to internalize that and use it elsewhere. And then when I started the YouTube channel, I do have a little bit of imposter syndrome. So when I first started, I just felt so dumb sometimes and maybe dumb's not the right word, but I mean, I just felt like an imposter. Like, I am no good at this. Nobody's going to want to watch this YouTube channel. Like, I don't know why I'm doing this. I should just delete the whole thing. And those moments are when somebody would reach out to me and tell me their story with VEDS. And I think that really reeled me back in to being more positive about it. And it just was so inspiring. So I think that's a big reason why I continued forward. And I don't think if that hadn't happened, I don't think that I would still have been doing the YouTube channel, which means I probably would have never started the podcast. So there's just a lot of pieces in there that I'm very grateful for.
Yeah, you should be grateful for. You have a lot going for you. And you talked a little bit about this with your mom and her being such a great support. How have your friends supported you? I don't know if you have any siblings. If you do, how have your siblings supported you through the years?
I think it's been really great. Honestly, at the beginning, it was really difficult because everybody deals with grief in their own way. And how I deal with grief is just like dive into research and dive into that knowledge space and talk about it and everything. And not everybody does that, So at the beginning with close family, it was kind of difficult because, some people wanted to just pull back and grieve and didn't want to hear about it every phone call, which is totally understandable. It was probably way overwhelming to talk to me every day about VEDS, but as we kind of came into this acceptance of it, I think I came into that acceptance a little bit faster, and then my mom did, and then my brother did, they started really trying to understand it. And I think that was the best way that anybody could have supported me, was just to try to understand it. As far as my friendships goes, I have a lot of good friends that really, they were just there for me to chat whenever I wanted to chat, whether it was about VEDS or something else. And the ones that remained really close to me never said like, oh, you could always get hit by a bus. Like, that was the thing that drove some of my friends kind of maybe less involved in my life, because they didn't really understand, and it felt kind of dismissive. So in a way, I developed even closer friendships because the people that I was surrounded by were very supportive for the most part. They wanted to know more. They wanted to understand it. They weren't dismissive about my feelings. They understood when I was having a bad day and I just didn't want to go out. I would just be like, I'm not going out today. Don't feel up to it. I'm just going to watch TV and cry. And they were like, okay, like, let us know if you need us. We love you. We know this is what you need. And I think that was the best way that to support me in that time.
It sounds like you have an amazing support system.
Oh yeah, I love him to pieces.
Including your husband.
Yes. He's been amazing, and he really met me in a time where like I was already comfortable with it. And that has been very interesting to, you know, meet somebody and you kind of disclose to them with a smile across the table, oh yeah, you know, I have this life-threatening condition, and you know, I could have an artery dissection at any time or something, and it's just kind of like shocking for them, and you're just like, oh, maybe I should like address that a little bit differently, you know, but it just kind of happened, and you know, we've had our ups and downs with it for sure.
For
sure. But he's very supportive and has done a lot to try to understand it too.
It's wonderful. Have you come to a place of acceptance with your VEDS? And if you have, how did you arrive at this place?
I definitely have. I think that, you know, there was a lot that happened before I was diagnosed in a way that, like, I grew up with most of my grandparents and great-grandparents, and in a matter of 10 years or so, all of them were gone. And so I got really, unfortunately, like, it was a very sad time, and I got used to constantly going to funerals and really just like came to terms with mortality, I guess. Because I had to do that to survive those 10 years. It's just kind of, okay, this is a normal part of life, is losing people. And couple that with, it seemed like off and on something would happen to me and I would ask a doctor and they'd be like no, it's fine, it's normal. Or I would go to a doctor's appointment and they would tell me I had something that might kill me. And they were sure of it and I needed to go see somebody about it. So it was just kind of this like up and down, like, you don't have anything. Oh, yes, you do. Or no, you don't. Yes, you do. And I had been tested for scleroderma 3 times. So by the time I got the VEDS diagnosis, I mean, I had already thought at 21 years old that I was not going to live till 25 because nobody knew what was wrong with me. And I really just wanted a doctor house, and I didn't know who a doctor house would be. And the doctors aren't talking to each other is kind of what I felt like when I was really young. And I didn't realize that's not normally how they do it anyway. But I thought that's how they should. So when I got the diagnosis, I mean, I think it was easier to accept because I had felt so strongly that there was something wrong, that we just didn't know what it was. And it gave this name to this thing now that explained every part of my body and made so much sense. And all of the things that before, like my hands, had pointed towards scleroderma, and now it was, okay, that's just a part of VEDS. It really explained everything, and in that way, it made it easier to accept because I already had this bad feeling about it. But I really think it's a very important thing to come to terms with, and a very difficult thing to come to terms with. The spontaneity of this is a very, very hard thing to accept. And I mean, I think, you know, some people take a few months, some people take years, and there's no really like right answer for how to do it. I think the thing that made it a lot easier for me was the amount I became connected with the community and the amount of knowledge that I was able to absorb from that. Just made it feel better. But everybody's different. So I'm not sure, you know, I don't know if there's a tried and true way to just accept it, but I have come to an acceptance with it. And, you know, I know that it's going to happen at some point, and I'm just glad that we have so much support right now, and with the VEDS movement, with the physicians on the Marfan Foundation's professional advisory board, with the VEDS collaborative and the researchers that are involved. I mean, I know that and maybe this is a really comforting piece of it, I know that even when I go, somebody else is going to continue to carry this torch. And it's not, 100 subscribers on YouTube that, the world might never see that channel. But because of everything that is going on now in 2020 for VEDS, like I just feel really comfortable knowing that if today was the end and that was it, I know that the fight will continue.
Mm-hmm.
Because we have such an amazing community and researchers and everything involved now. So
it gives you peace.
Yeah, it really does. It gives me a lot of peace. It's not that like panicked fervor that it was in 2017 now.
Mm-hmm.
Now it's just this calm possibility, and I just know it's there all the time.
So our last question is for other people that are struggling with VEDS, what advice would you give them?
Find community, I think, is a very big thing. That has been so helpful for so many other people to, get onto a virtual support group. It's not scary. It's like everybody is so nice. There's an online community that is so vibrant and willing to help, and they want to connect with others. And that can provide so much like camaraderie. Like it's just
Mm-hmm.
to sit across from somebody, even through a computer, who knows what you're going through, and they understand it, and they're going through the same thing. That is such an important experience. And I think the other thing would be to really find an expert. We have a wonderful list of amazing physicians across the country on our vedsmovement.org website.
Mm-hmm.
And these are physicians who are on the professional advisory board for the Marfan Foundation. They know what VEDS is. They're learning more about it. Not all of them have been involved in VEDS for a long time, but they are definitely involved now. And, get connected with an expert, because everybody needs a local care team. That is extremely important. But having an expert, even, just here and there, you talk to them, or you go to one appointment a year, or, just establish, maybe you go to one appointment, they can give you so much good information that you might not have access to with your local care team who hasn't had a patient with VEDS before. And I think both are really important pieces, because having that appointment, my first appointment with Dr. Byers, right after I was diagnosed, that was the best appointment, hands down, of my life. Just finally meeting somebody who had been researching VEDS his whole life and been involved in the community, and really they treat patients like family. That is such an important piece to being comfortable with your diagnosis. So I think those are the things I would advise. Get connected with the community and get connected with an expert.
Great advice.
Thank you.
This was so great, Katie. You're such an inspiration. Bye.